My name is Bill Haley for the government reform idea called Competitive Healthcare Systems. It's one of the Haley 2024 The Movement's government reform ideas where we dramatically change the structure of government to a competitive governance system. So within healthcare, this is how we're going to do competitive healthcare. And we're going to talk about it a little bit here, try to keep it below 5 minutes or so on this one. Some people want total free enterprise within healthcare, and some people are really afraid of total free enterprise within healthcare. Some people want total socialized medicine, so one payer system within the government. And many people are very, very afraid of that. It's one of the aspects of socialism, and there's just a lot of problems with that part. Many people can point out significant problems. You lack your liberty, you lack your choice. Somebody else is in charge of what you get in healthcare. You do not have the liberty or freedom to buy your own healthcare, to make your own healthcare decisions. It's done by the government when it is paid for by the government. The golden rule applies here. Whoever has a goal makes the rules. Whoever's paying the doctors gets to decide what they're paying for. And if you say, well, no, I didn't get to decide. Well, government says no, then you don't get to decide because government's the one with the money. And you have to go to government to address your liberties. Well, it's not a liberty if you have to go to government to get their approval and their money taken by other people. So while I'm definitely not socialist by any means possible, any way possible, do you want to go for toll free enterprise where you don't even have emergency room coverage for somebody who is immediately in danger because they cannot pay right then and there? So there is that issue there. And there's ways to address that within the system. We have a big enough country to have a dozen different complete systems. Now, a dozen different complete systems, many healthcare providers will be within, let's say, 6 of the 12, or even many of them. So some people want full, some people want half and half. Some people want 90% free enterprise, 10% socialism, where it's only there for the extreme cases, or just there for that emergency care, or just there however they want it. So that's why we have a dozen different systems. So our country and our states are big enough for that. And you would say, well, we only have one emergency room and big hospital in our city, or within 30-minute drive from our house. Well, do I have to go 2 hours to one that I agree with? No, every hospital will pretty much be mandated to have rooms within each hospital to some degree. I don't want to go too far in saying that, but the system will go in that direction where if you have an emergency room and you're part of one system, they have to still take you to some degree. I like that law, but you are also required to pay. And if you don't pay, you get put into the charity system. You have a system of paying that back. It's automatically there's a system to make sure you are paying it back, so somebody does not give you uncompensated care. That can reduce down the emergency room costs significantly because a lot of people don't realize it, but emergency room costs are that high because so many people come and use the system and not compensate. That they don't pay. So they have to pay, they have to have $1,000 for a 1 hour visit there because they have to make up for the 9 people who don't pay. Anyway, so a lot to it. So I have a full system here. This can be used within Medicaid. This can be used within Medicare. So this can be used in many different ways. And you can read it and you can choose which one you want. I want to get rid of the health insurance being tied to your employment because I don't want, when I go to find a job, I don't want to have to pick my health insurance as I pick my job. I want that separated. And there's reasons why, government regulations, why it's tied together, and I want to take it away from that by changing those government regulations and the like. So we can do a lot of different things, but these about a dozen different bullet points, plus a lot of bullet points on my website to talk about how competitive healthcare system works. Now, I want to go from a mandated government tax to pay for welfare to a mandated government contribution to your charities, and charities take care of some healthcare needs. So that's a big part of it. Plus just other reforms out there that's going to be a big part of the system change. Okay, a lot more to see at Haley2024.org. I really want to push these messages out there. Yes, I want to help the poor, and I want to make sure everybody has health care. But if we don't keep free enterprise strong, then we really have a lot of problems. And we're going farther and farther away from having free enterprise being strong and more into government control, which means a lot less liberty, a lot less advances in the medical field. Even though it's coming fast because of free enterprise, and we're starting to have the computers, and we're starting to have more experts in the field and more time that people can put towards that, because hey, food and housing and clothing and all that stuff is taking a much smaller percentage of our budget now, which means we can put more of our overall budget towards healthcare. So it's coming quick, and advances are coming quick, but is it being done through free enterprise? That could be done a lot better. Anyway, a lot to consider. Please go to my website. Please consider a donation so we can try to get these things pushed through. And until the next video.